positive due to Orton's jelly contamination, which leukemia does not have peroxidase activity. Acute lymphocytic leukemia. Which of the following tests give a presumptive identification of Moraxella catarrhalis if the isolate is a gram-negative diplocochi that is oxidase positive and isolated from a body fluid from the middle ear? Beta-lactamase test. Which of the following hemoglobins is not normally present in a normal adult? HbS. What hemoglobin derivative causes irreversible changes in the red blood cells? Self-hemoglobin. Which tapeworm eggs have an operculum at one end and a small terminal knob at the other end? Diophilobufferum latum. Sex-linked immunodeficiency disorder with absence of plasma cells resulting in the lack of antibody production. Bruton's agammaglobulinemia. In the Duffy blood group system, what is the most common antibody detected? Anti-Phi. What does the presence of urinary ketones MOST likely indicates? Storage lipids are being used as the primary energy source. Classic hemophilia is the result of a deficiency of which coagulation factor? Factor VIII. When performing spectrophotometer quality checks, what is the holmium oxide glass filter used to assay? Wavelength accuracy. To achieve the best levels of sensitivity and specificity, a gas chromatograph may be coupled with which of the following? Mass spectrophotometer. Which of the following factors does not require vitamin K for its production by the liver? 8. Hydrogen sulfide production, other than in triple sugar iron agar, requires a source of metal and what other component in the test medium? An organic source of sulfur. Gram-negative rod isolated from a urine culture has the following reactions: MBC++, motility positive, urease negative. What is the most likely identification of the organism? Escherichia coli. Which of the following laboratory procedures is routinely used for the detection of hepatitis B virus in blood donors? Enzyme-linked immunosorbent assay. Major histocompatibility complex. The genes that control expression of the HLA antigens. Frequency of group A in US population. 41%. Reactive sites on an antigen known as. Determinants. What hemoglobins are differentiated by the Klein-Hauer-Bethke technique? HbA1 and HbF. What will happen if blood is exposed to air during specimen collection for pH and blood gases? PCO2 decreases. Which one of the following is not a labeling requirement of specimen cross-matching? Ordering physician. Paroxysmal cold hemoglobinuria is often associated with which antibody? Anti-P1. Not to or concerning IgG. It has 4 subclasses. Other than the D antigen, what other blood group antigen is a potent antigen? K. Which differential test for identifying the species of Mycobacterium splits phenolphthalein from tripotassium phenolphthalein sulfate within 2 to 3 days? Aryl sulfatase test. Major autoantigen of the thyroid gland. Thyroglobulin. What is the lifespan of an erythrocyte? 3 months. Typo should be 4 months. What is the purpose of the antibody conjugate in the FTAABS test? Makes the antigen-antibody reaction visible. Mentu skin test is an example of which type of hypersensitivity reaction? Type 4. The cryptococcal antigen test is rapidly replacing which lab test? India Inc. In the heterophil antibody test, which of the following constitutes a positive reaction? Agglutination. Which determination is considered a reliable assessment of effective erythropoiesis in the bone marrow? Reticulocyte count. All of the following are indications of anemia except which one? Decreased PLT. A titration was performed and the titer was 8. What is the most likely explanation for the result? Antepartum administration of RHIG. Which of the following allows visibility of acid production by oxidizers in oxidation fermentation medium? Peptone content is low. Which hormone consists of 2 non-identical, non-covalently bound subunits? Human chorionic gonadotropin. Which of these lipids has the lowest density? Chylomicrons. Direct reacting bilirubin is also known as what substance? Bilirubin diglucuronide. Which one of the following is a characteristic of immune blood cells? Presence of euchromatin. The rheumatoid factor latex slide test uses diluted patient serum plus latex chemist with which one of the following? Antihuman globulin. What role does cardiolipin play in VDRL test? It is a neotroponemal antigen. Which hemoglobin is resistant to alkali denaturation? HbF. GAS antigen. Group A streptococcal. Which system is composed of antigens found primarily in saliva and plasma? Lewis. Listeria monocytic genes produces a positive in which one of the following biochemical tests? Catalase. What is the renal threshold for glucose? 160 to 180 milligrams per deciliter. How many IgG classes? 4. Which statement is true concerning the RPR test? It does not require an inactivation of serum. Which tapeworm could be acquired through the ingestion of medium rare steak? Taenia sacchinata. In the enzyme-linked immunosorbent assay, what is the antihuman globulin conjugated with? Horseradish peroxidase. What is the function of N-acetyl-L-sectin-O? Liquefy mucus and control contaminants. Inactivation of sera for serological tests is performed for what purpose? Destruction of complement. Fc. Which fragment of the antibody molecule? Crystallizable. Which serum enzyme begins to rise 2 to 4 hours, has peak activity occurring 12 to 36, and returns to normal 2 to 4 days after as acute myocardial infarction? creatine kinase. What is the method of choice for confirming drugs detected by screening methods? Gas chromatography, mass spectrophotometry. Which of the following hormones is considered a glucocorticoid? Cortisol. Giant bizarre platelets, nucleated red blood cells, and teardrop red blood cells are associated with which clinical condition? Myelofibrosis. Which statement is not true concerning the causative agents of dermatophytoses? Trichophidin rubrum has cleft-shaped macroconidia. Smudge cells can cause the automated WBC and the WBC estimate not to match. What action can be taken to prevent this occurrence? ADD 22% bovine albumin to stabilize the WBC. What is the origin of platelets in the bone marrow? Megakaryocytes. What are erythrocytes with a diameter of 9 to 12 microns referred to as? Macrocytes. Which of the following patients' labs results are not consistent with anemia? Toddler, HbG 12.5. What causes the red cell color of immature erythrocytes to appear polychromatophilic? Residual RNA. Associated with secondary component. IgA. All of the following tests are good indicators of hypothyroidism except which one? T3 uptake. Which statement does not apply to white blood cells in the urine sediment? White blood cells in the urine must be accompanied by proteinuria. Which gram-negative anaerobic is resistant to penicillin? Bacteroides fragilis. What is hemoglobin composed of? 4 HCME, 4 iron, 1 globulin. The enzymatic hydrolysis of triglyceride may be accomplished by what enzyme? Lipase. Which of the following amino acids are used in the test for decarboxylase? Lysine, arginine, or nifin? Which of the following cells are commonly seen in chronic lymphocytic leukemia? Smudge cells. What is the reporting unit of measure for enzymes? IUL. Which one of the following statements concerning hemolytic anemia is false? The serum hepatoglobin is increased. Neisserum meningitidis degrades which of the following sugars? Glucose and lactose. Which one of the following organisms causes whooping cough? Bordetella pertussis. Which antigen is destroyed by enzyme? Phi. Which clostridium produces a double zone of hemolysis around colonies on blood agar? C. perfringens. In ASO, why should streptolicino not be rehydrated until it is needed? Is destroyed by oxygen. Acute lymphocytic leukemias that have a predominance of homogeneous cells with a high NC ratio belong to which FAB group? L1. Fundamental purpose of the cross-match. Detect recipient antibodies directed against donor red blood cells. Antigen structurally similar to the original antigen, the induced antibody production. Cross-reactivity. Which of the following is not a streptococcal extracellular product? Isomerase. Which test is less likely to be reactive in primary and early secondary syphils? MHATP. Which statement is true concerning acid-fast bacilli from a nasal mucosa specimen? Are not a diagnostic characteristic? Which test for syphilis uses plastic coded cards? RPR. Ovarian cancer. CA125. Immunoglobulin dimer. IgA. Combination of electrophoresis and double immunodiffusion. Immunoelectrophoresis. What virus is the most frequent cause of gastroenteritis in children during the winter months? Rotavirus. The following results are available on a 27-year-old female. PT 20.5, PTT 43.0, fibrinogen 141. Liver disease. Which of the following differentiates Thayer-Martin medium from modified Thayer-Martin medium? Trimethoprim lactate. Which one of the following specimens may be inappropriate for culturing Neisseria gonorrhea? Which hormone appear to function solely in the initiation and maintenance of lactation? Prolactin. Increases during the convalescence phase of infection. IgG. Effective phagocytosis occur in the presence of which? Opsonins. How is rickettsial disease transmitted? Arthropod vectors. The classic Clark-Collip method for calcium is based on which assumption? Calcium will be precipitated as an oxalate. What does the peripheral blood smear show in a patient with iron deficiency anemia? Microcytic hypochromic cells with poikilocytosis present. Which term best describes the branching, intertwining structures of molds? Mycelium. What is the order of migration of hemoglobins from faster to slowest on cellulose acetate at telephone 8.4? A1, F, S, C. Increased iron in the mitochondria of normoblasts is characteristic of which type of anemia? Sideroblastic anemia. What is the immediate precursor of the band polymorphonuclear neutrophil? Metamyelocite. All of the following antigens define the kid blood group system except which one? N. First immunoglobulin. IgM. Which enzyme is the most sensitive indicator of obstructive jaundice? Alkaline phosphatase. Proteins may become denatured when subjected to mechanical agitation, heat, or chemical treatment. What does denaturation of proteins refer to? Alteration in tertiary structure. How many tubes are required to perform decarboxylase test? 4 tubes are needed, 1 for each substrate plus 1 for control tube. Which activated coagulation factor converts fibrinogen to fibrin? Thrombin. Potassium telluride medium produces what color colonies of Corynebacterium diphtheri? Gray-black. Non-fermenters produce the reaction in triple sugar iron agar. alkaline, slant, alkaline or neutral but. Dual bodies are found in the cytoplasm of which cells? Neutrophils. What is hexokinase methodology for glucose determination based on? Reduced coenzyme rate at 340 nanometers. Anti-C plus, anti-E plus. What is the most common genotype that could result from the following phenotype? RR. End product of complement activation. Cell lysis. How should mycobacterial cultures be incubated? In 5% CO2. If the hemolytic transfusion regimen is suspected, which blood bank procedure should be performed immediately? Direct antiglobulin test on the post-transfusion specimen. Which statement concerning anti-I is incorrect? It reacts best with cord red blood cells. What is the classical method for creatinine reaction? Jeffy. What is the normal range for pH of blood? 7.35-7.45. What is the estimated percentage of patients immunized to blood group antigens? 1 to 4%. What is the stability of the VDRL antigen suspension? 24 hours. Increased CSF IgG index. Multiple sclerosis. Both porphobilinogen and urobilinogen form a red-colored compound with Ehrlich's reagent. How can they be differentiated? Urobilinogen is soluble in chloroform. Which of the following can be attached to a solid phase support? Antibody or antigen? Which hormone stimulates contraction of the gravid uterus at term and also results in contraction of muepithelial cells in the breast, causing ejection of milk? Oxytocin. Immunoglobulin class is produced by transfusion or pregnancy. IgG. Beta-methylaminobenzoate is a constituent of which reagent? Ehrlich. Which test, when positive, can be used for the presumptive identification of Candida albicans? Germ tube test. Antibodies that are produced after exposure to foreign antigens that are stimulated by transfusion or pregnancy. Allantibodies. Which of the following fluorochromes gives a minimal false reading? Fluoresceinoisothiocyanate. Most common reason for mixed field agglutination. Dimorphic population of transfused red blood cells. What does the autocontrol contain? Patient serum plus patient red blood cells. Anti-C can be formed by persons with which genotype? R1. What specific cytological finding can be differentiate acute myelogenous leukemia from acute lymphocytic leukemia? Presence of aurons. Which coagulation factor is known as the Christmas factor? 9. What is the normal plasma concentration of fibrinogen? 300 to 400 milligrams per deciliter. A 27-year-old female complains of mucous membrane bleeding. Disseminated intravascular coagulopathy. To calculate the mean corpuscular volume, what parameters must be known? RBC and HCT. Not true concerning complement. Complement proteins are heat liable. Which red blood cell shows peripheral rim of hemoglobin with a dark staining central area? Leptocyte. The direct antiglobulin test is most useful for which of the following purposes? Detection of hemolytic disease of the newborn. What is the most common method for measuring sodium? Ion selective electrode. Which reagent is employed in the serum protein determination? Biuret. All of the following statements concerning autologous transfusions are true except there are no donor blood requirements for them. What disorder does defect in heme synthesis lead to? Porphyria. Why can't monoclonal antibodies be used in complement fixation tests? They cannot fix complement. Red blood cells of which group react only with anti-H? O. When color coding is used for donor blood labels, what color is group A? Yellow. The following results were obtained from a CBC specimen: WBC 10.3, RBC 4.19, HBG 9.9, HCT 27, MCV 95, MCH 33.2, MCHC 33.1. What is the most probable cause of these results? Anemia. Antibody determined by the antigenic variation found primarily in which region? Constant region of heavy chain. What is the indicator in Simmons citrate agar? Bromdimol blue. Standard acceptable color for anti-A grouping serum. Blue. Not a function of the complement system. Involved in the production odd antibodies. Production of more antigen in the homozygous state than in heterozygous state is referred to as which one of the following terms? Dosage effect. Responsible for antigen binding. Variable. What is the morphology of Corynebacterium diphtheria? Gram-positive non-modal rods. After centrifuging a microhematocrit, the presence of lipemia is noted. What is the most appropriate correction action? Perform saline replacement procedure. Which of the following is the reagent used for the string test? 0.5% sodium deoxycholate. What is the best explanation of these results? Rh hemolytic disease of the newborn is suspected. Clinical test to be positive in the absence of its homologous antigen. Sensitivity. What do the Whittle and Weil-Felix tests detect? Febrile agglutinins. Which one of the following is anaerobic? Actinomyces israelii. Eosinophilia may be found in all of the following conditions except which one? Erythroleukemia. Which statement is true concerning the I antigen? It is poorly developed on cord blood cells. What color is a negative enzymatic hydrolysis twin 80 test? Amber. Which one of the following organisms does not belong to group 4? Mycobacterium gordoni. How is a positive patient reaction expressed in a complement fixation test? Inhibition of hemolysis. Gram-negative, coffee bean-shaped duplicoche with adjacent sides flattened is descriptive of which of the following? Neisseria. Lyse-resistant red blood cells detected by automated hematology analyzers are seen in which clinical condition? Sickle cell anemia. What is the acceptable temp range for blood bank refrigerator? 1C6C. Which one of the following parasites has not been transmitted by blood transfusion? Naegleria. An increase in the erythrocyte sedimentation rate can be the result of an increase in the quality of which one of the following? Fibrinogen. Shelf life of platelet concentrates. 5 days at 20C 24C with constant aggregation. What is erythema chronica migrans? Sign of Lyme disease at the site of tick bite. Which one of the following is not true of anti-Lee? Causes hemolytic disease of the newborn. Glycoproteins and mucoproteins are usually bound to which substance? Monoclonal gammopathy. Diseases of which system are associated with elevated beta-lipoprotein values? Cardiovascular. Prenatal patients with borderline blood glucose levels are further evaluated by which test? 3-hour glucose tolerance test. Donor that meets all requirements for age, pulse, weight, and blood pressure. 32, 60, 185, 110/70. Abundant plasma immunoglobulin. IgG. Expiration date of blood preserved aphthol. 42 days. Which immunoglobulin is measured in the radioallergostrobin test? Ig. Region contains the disulfide bridge.